Approximately 7 years ago, a rare opportunity presented itself to change the way we deliver services, and that's both patient and clinical services, within the Lyell McEwan Hospital.
Our involvement with the managed healthcare service at Lyell McEwan has been sponsoring the use of this new convergent technology to see how patient entertainment and clinical access can be merged together.
So they have a TV system which is a touch screen near the patient beds, and that not only gives the patient an entertainment system, but we can also use it to access clinical information.
They now have access to Foxtel, to the internet, where they can access their personal email accounts, and they also have an IP-based telephone attached to the bedside unit. The system's extremely easy to use. All the access is driven by touchscreen technology, and from the clinical perspective, the secure smart card enables the clinician to open their application privileges at one bedside and then port them to the next bedside by moving the smart card.
You can use the system to get information about not only test results but also ordering of tests, ordering of medications. If all that can go into an electronic system and be available in one place at one time, I think the whole system becomes a lot more efficient.
It's a fantastic advance in the bedside management of patients from a clinician point of view because of the ready access to all our pathology and radiology data, and it gives us an opportunity for enabling the patient to inform themselves about the problem which has produced their admission.
We've always believed that good hospital experience leads to improved clinical outcomes, so if the patient's happy, then the hospital's happy.
In the longer term, we would look at remote monitoring of patients where they have a camera installed on the unit that can be monitored from the nurse's station. There's also positive patient ID, which prevents misidentifying patients and obviously then mistreating patients or giving them the wrong treatments.
In terms of administrative support, we're looking for food ordering so the patient can fill in their menu, which will provide us with operational efficiencies. And we've even thought further ahead with the ability to bring in virtual doctor where they can talk to their GP via a webcam, and that way we can reduce the need for patients to stay in longer than they have to.
At the moment, we're heavily dependent upon clinicians being physically present, particularly in the rural and remote areas. Once we have sufficient bandwidth, we'll be able to make much better utilisation of clinical expertise from Adelaide out to those communities.
This hospital is known as an innovative hospital. It has a visionary IT backbone to it, so when you have something that's been set up from innovation and a passion, it's extremely important to work with a partner who's equally as passionate about what they do and what they can bring to the project.
We are very excited about the potential for this technology. It is now changing the paradigm of how we actually approach clinical information, how we deliver it.
The managed healthcare service is the ultimate in converged IP-based bedside technology. In fact, the future is only limited by our imagination.